Of all the problems facing the United States right now, none are more important than health care. President Obama says rising costs are driving huge federal budget deficits that imperil our future, and that there is enough waste and fraud in the system to pay for health care reform if it was eliminated. At the center of both issues is Medicare, the government insurance program that provides health care to 46 million elderly and disabled Americans. But it also provides a rich and steady income stream for criminals who are constantly finding new ways to steal a sizable chunk of the $500 billion that are paid out each year in Medicare benefits. In fact, Medicare fraud, estimated now to total about $60 billion a year, has become one of, if not the most profitable crimes in America. We caution you that this story may raise your blood pressure, along with some troubling questions about our government's ability to manage a medical bureaucracy. If you want to find Medicare fraud, the first place you should look is South Florida, where we were told it has pushed aside cocaine as the major criminal enterprise here. It's a quiet crime, no sirens or gunfire. The only victims are the American taxpayers, and they don't even know they're being ripped off. FBI Special Agent Brian Waterman, who we rode with for several days, told us the only visible evidence of the crimes are the thousands of tiny clinics and pharmacies that dot the low-rent strip malls. You don't even know they're there because there's never anyone inside. No doctors, no nurses, and no patients.
This office number should be manned and answered 24 hours a day.
This tiny medical supply company billed Medicare almost $2 million in July and $500,000 while we were there in August. But we never found anybody in, and our phone calls were never returned. Say they're currently on the other line.
Oh. Well, do they want you to hold?
Sometimes they don't even have offices. We went looking for a pharmacy at 7511 Northwest 73rd Street that billed Medicare $300,000 in charges. It turned out to be in the middle of a public warehouse storage area.
They've already told us that there's no offices here, there are no businesses here. In fact, they're not even allowed to have a business here.
Waterman is the senior agent in the Miami office in charge of Medicare fraud. And Kirk Ogrovsky, a top Justice Department prosecutor, oversees half a dozen Medicare fraud strike forces that have been set up across the country. This one operates out of a warehouse at a secret location in South Florida and includes investigators from the FBI, Health and Human Services, and the IRS.
There's a healthcare fraud industry where people do nothing but recruit patients, get patient lists, find doctors, look on the internet, find different scams. There are entire groups and entire organizations of people that are dedicated to nothing but committing fraud, finding a better way to steal from Medicare.
Is the Medicare fraud business bigger than the drug business in Miami now?
I think it's way bigger.
What changed?
The criminals changed.
Sophistication.
They figured out that rather than stealing $100,000 or $200,000, they can steal $100 million. We've seen cases in the last 6-8 months that involve a couple of guys that, if they weren't stealing from Medicare, might be stealing your car.
You know, we were the king of the drugs in the 80s, we're king of healthcare fraud in the 90s and the 2000s.
Man, what did they tell you?
But it's not just Miami. In March, the FBI arrested 53 people in Detroit, including a number of doctors, and charged them with billing Medicare more than $50 million for unnecessary medical procedures. And in Los Angeles, the City of Angels Medical Center recruited homeless people off the street to fill their empty beds, offering them cash and drugs plus clean sheets and 3 squares a day while billing Medicare tens of millions of dollars for their stay.
We have to understand this is a major fraud area.
United States Attorney General Eric Holder has taken a crime that's been in the backwaters of law enforcement and made it a top priority at the Justice Department. Why do you think it's been so attractive for the criminals?
Because I think it's been pretty easy. I think that they have found a way in which they have been able to get pretty substantial amounts of money with not a huge amount of effort, and at least until now, without the possibility of great detection.
With much fewer risks.
Much fewer risks. You'll see some of these people and they'll say, you know, there's not a chance that you're going to have some other drug dealer shooting at you. The chances of being incarcerated were lower. The amount of time that you would spend in jail was smaller, all of which is different now.
You're waking up every day making $20,000, $30,000, $40,000, every day, almost literally. And you're like, wow, I mean, I just won the lottery.
Let's call this guy Tony. That's not his real name and obviously not his real face. But before he was ratted out by a friend and brought down by the FBI, he was making Wall Street money running a string of phony medical supply companies out of this building. They were theoretically providing wheelchairs and other expensive equipment to Medicare patients. How much money did you steal from Medicare?
About $20 million.
$20 million?
Yes.
Was it easy?
Real easy.
And you're not exactly a criminal mastermind.
No, not really. It's more like common sense. That's all you need here.
Did you actually ever sell any medical equipment?
No. No. Just have somebody in an office answering the phone like if we're open for business, and wake up in the morning, check your bank account, and see how much money you made today.
You didn't have any medical equipment. You didn't really have any clients either, did you?
No.
All of it was fake?
All of it was fake, yes.
And you would just fill out some invoices and some forms and send them to Medicare?
And that's it. And 15 or 30 days, you'll have a direct deposit in your bank account. I mean, it was ridiculous. It's more like taking candy from a baby.
According to the FBI, all you have to do to get into this business is rent a cheap storefront office, find or create a front man to get an occupational license, bribe a doctor or forge a prescription pad, and obtain the names and ID numbers of legitimate Medicare patients you can bill the phony charges to.
There's a whole industry of people out there that do nothing but provide patients.
When you say provide patients, what do you mean?
I'm just talking about lists of patients, people's names, social security numbers, addresses, and date of birth. With those 4 things, you can bill for a patient.
In order for Medicare to pay, you need to have a Medicare patient. Where do you get those?
There'll be people that sell you a list of maybe $10 per patient, and I'll buy 1,000, 10,000 maybe at a time. And then you just fill in that patient's name, and you send it. And then I'll use the same patients with the same company. Then the next company, I use the same patients and keep using them. And they'll pay for the same patient every time.
Once the crooked companies get hold of the patient lists, usually stolen from doctors' offices or hospitals, they begin running up all sorts of outlandish charges and submit them to Medicare for payment, knowing full well that the agency is required by law to pay the claims within 15 to 30 days, and that it only has enough auditors to check a tiny fraction of the charges to see if they're legitimate.